Hi, my name is Jackie Gadd, and I am a student in the cohort for the 2026 Physical Therapist Assistant Program at Mesa. And I wanted to recap for you some of my perspective on my first clinical rotation. So I was at the South Bay Post-Acute Center in Chula Vista. It's a skilled nursing facility. It has 99 beds. It's in the old Chula Vista Hospital, and the therapy department is physical therapists, physical therapist assistants, occupational therapists, COTAs, as well as speech and language therapists. What did I find helpful during my prep for clinical experience? I had been in contact with my CI, and she advised me to do one thing in specific, which was review all my transfers. It's important to make sure that you kind of get a feel for what is min, mod, max, total, a little bit more maybe if you have an opportunity to practice with somebody, because when it gets real, like Dr. Bachman said, it can be really intimidating. Reviewing some of the neuro information as well, like kind of treatments for people with traumatic brain injuries, spinal cord injuries, CVAs, pathologies like CVA, COPD, diabetes, how to progress patients that are really deconditioned. Those are all things that are going to be helpful. And you've been really well prepared by the instructors, but it doesn't help to have those notebooks handy. And also checking back about different tests like the tug tests, the 2-minute walk tests, just making sure you kind of know on the fly how to whip those out. What would I recommend to a classmate who will be completing their clinical rotation? If you're not a Spanish speaker, and I didn't find out till day one that this was something that was a big deal, very common at the facility, was that there's a lot of people that are not native English speakers. And my Spanish is pretty marginal, so patients were really nice in me kind of going over, asking them questions, helping me out with Spanish. But in the case where we had a complete language barrier, it's nice to use Google Translate. If you have Spanish speaking experience, that's awesome. Also, don't be afraid to ask somebody for help in interpreting for them. And I'm actually going to take a couple-week class on Babbel just to make sure that I'm prepped for my next rotation, to make sure that language isn't a barrier. Specific challenges that we experienced, that was one of them, the language barrier, and the strategies were to make sure that I didn't feel shy about asking somebody for help. The biggest one I would say is kind of this idea of productivity, where you have to have multiple patients that have a specific amount of minutes. They're not consecutive back to back to back to back to back. You actually have to kind of compress the schedule, so you'll have overlapping time, and being able to work with one patient, give them a break, move on to the next patient, give them a break, and kind of double back. Keeping people in the same room helps, but it doesn't always work out like that. So an eye on the clock, setting a watch time for, if you say 15 minutes, make sure it's only 15 minutes. And then by the end of the rotation, I had this routine of getting my schedule for the day, writing out kind of a time card of every 15 minutes or every 30 minutes, and writing in which patients I thought would fit in at which time slot. So that was actually really helpful. It got me closer to hitting those timelines, and at the very least finishing the day in time to do all the documentation. Documentation was another challenge, because the style that they do their documentation is different from what we learned in class. Not that the kind of qualitative stuff is different, but the layout is very different, and how they want you to explain and do your assessments. So give yourself grace, and maybe I would take little pictures with my phone of just the paragraph on the assessment, so that I could then go ahead and write it out and practice it, so that I was ready when it would come to writing the assessments once I got into clinic. Expectations of the CI in the facility for time management and documentation. It's a pretty hectic environment. And the way it worked is I didn't have my own login, so I would get the roster at the beginning of the day. My CI would give me a chance to sit at her computer and look up the do chart review. So it was a very compressed timeline. You weren't able to necessarily focus 100% on one patient. It was getting the basics in really, really quickly. What are their precautions? What is their major diagnosis? And for me, it was going back and looking, what was the last treatment that they did if I didn't do it? So I know, do I stick with that and watch for the opportunity to progress? Do I mix it up a little bit with them? Most importantly is patient safety. So always having the gait belt on them, doing that wheelchair follow, making sure you have a good grip on kind of the upper waistband of their pants and the gait belt, making sure you're guarding appropriately, making sure that when they're in the wheelchair, you're really mindful of how you're wheeling them around so you don't bump into walls. Somebody that just had some toes amputated is not going to appreciate that. Protecting your body, so good body mechanics, they keep emphasizing, but that is super important. So elevating that bed so that when you do a transfer, you're not having to squat down so low, and that your patient has the benefit of kind of gravity so that they're not trying to push the floor away, but actually kind of just holding their balance. Sorry, that was that's my dog. Knowing the facility layout is helpful too, whether it means you do a diagram or you just do a quick kind of walk through the building every day to go, okay, I got to remember which rooms are where are the linens, not being shy about asking nursing for support, saying, hey, can you help me with that? The things that I had a little bit of trouble with is figuring out where the boundaries are between kind of what a CNA is going to do, what an OT is going to do, and just trying to partner with everybody appropriately. Some of it is really hard to explain in detail, and it's more kind of on the job, you're figuring it out. So as long as you're really flexible and kind of can give yourself some really positive self-talk about this is a learning process, and if I'm keeping the patient safe and I'm providing a good treatment, you're doing okay. What did I like about my setting? I really liked the opportunity to work with people that are in the older population, people that are in recovering from injuries or chronic illnesses. I feel a calling towards being able to facilitate people refinding use of their body. And it's very rewarding for me to do that, knowing, that a patient felt really comfortable talking to me, and I was able to encourage them. Because of that, I was able to encourage them to participate in their treatment. It feels good for me. So maybe that's not 100% altruistic, but that's what I liked about it. I also liked that there is quite a bit of autonomy at this place. You're not, 9 o'clock you do this, 10 o'clock you do this, but that's not for everybody. So can I see myself working in this environment? We'll see. I haven't experienced a lot of other places, in fact, any other places other than observing in an outpatient. So it's going to be really interesting to see what the next 2 rotations are like. I wanted to wrap this up, but good luck on your rotation. Make sure you communicate everything to your DCE about kind of what you're most comfortable with, and know that especially Dr. Bachman is going to really try and match you up with something that's going to challenge you, but also be something that you're going to feel good about doing. So take care. Bye.